I was in an apple orchard on a shoot. I was clearing some poison ivy, and when I touched it, I felt something's not quite right. It turned into an angry red infection. I went into a walk-in clinic and took oral antibiotics that the doctor prescribed for me, and by 3 days later, it just wasn't getting better.
This is Dr. Vitale. I know you had an abscess on your finger, which we sent some labs off on, and it shows that the bacteria that you have is not sensitive to the antibiotics we've been giving you. So I hope you're checking your message. You should come to the ER as soon as possible.
Obviously, they had cultured it. They found out it was MRSA. And when I talked to the doctor, I was like, well, what is that? And it kind of rang a bell. They call it the superbug. I heard other people had died from it. Recently, it was in the news. He lanced it. It was excruciating pain. They put me on intravenous antibiotics in a private room because this was an infectious disease.
So I think another day or so of the IV vancomycin.
I don't know. I thought 4 days in the hospital could be what, like maybe $5,000 or maybe $1,000 a day or something. But all those people would come and visit you. It all kind of added up to way beyond what I ever expected. I didn't have insurance. About a month later, I went to Thanksgiving. I was riding home on the bus and I felt something wrong. I felt something on my thigh. It was, I guess, the return of the MRSA. Going back to the hospital meant that I was going to get my leg stabbed, basically. I'd have a whole lot more pain, and it didn't work the first time, and now it's going to cost a boatload more. I was already in debt enough with the hospital. If this could be handled other ways and more powerful ways, let me do that.
Mark calls me one evening saying, I have MRSA, can you do something about it? It's highly uncommon to have someone call with what would be deemed an acute condition. It's a very strong bug, and that bug will kill you.
Pierre had to change the dosages, tried a few different remedies until he found the right one. It came to a point as this boil took hold that I couldn't even walk without feeling extreme pain. Pierre wanted me to go to the hospital. I mean, my friends, people were concerned. I had an inside name of somebody who had tested me originally, and I called her directly and said that I would like to test this ooze that's coming out to see if it was still the MRSA bug. She said, well, you should get yourself to the hospital. I mean, you could do homeopathy later. You need antibiotics now.
Knowing how lethal this is, there's one night where I really could not sleep at all.
Yeah, I mean, that bulge is going. There's just no two ways about it.
At one point he gave me some on my tongue and I could immediately feel the vibrations of the remedy at work. I had my desire to really follow this through, and I kept checking my fever.
99.4.
Wasn't out of control, and I got through it. It started to heal.
Within 6 to 7 days, we were out of the woods.
Sent photographs of the progress for review by Pierre.
Hey, Mark, Pierre, I'm looking at your picture here. Very good. It's great. It's a big improvement. Clearly, this is just unbelievable.
We have culture before and culture after. Not only the wound healed, but the nasal culture where MRSA generally resides is also clear. There is no MRSA, period. The courage of Mark to look for something else, to me, was one of the most remarkable aspects of all this.
I put caution at the wind and went for my own way of healing.